Okay, so here we go. This is called the brain-body diagram. I know you had the opportunity to look all through this diagram, and you're going to be reading different things before I actually speak about them. And that's okay. But while I'm speaking, try to follow along, because I think if you do, it'll lend a great explanation to the differences between the allopathic traditional medical approach to addressing symptoms in people's health concerns, your health concerns, and the difference between that and the functional medicine approach. So let me help you here. So you've got the brain. Brain sends all the signals to the rest of the body, and it does so through the nerves and through the hormones, right? So we've all got those. We've got nerves and hormones, and that's how the body communicates from the brain, gets messages. So when that happens, and it happens well, it happens at 100%. You wouldn't have any symptoms to speak of at that point, especially no chronic symptoms, right? So that happens at 100%. We consider that normal. So it's a normal function between the brain and the body, and the body is in a state of ease. As soon as we have symptoms, we have dis-ease. So we go from here to a dis-ease, and we go from here to a malfunction, and we can no longer consider the communication between the brain and the body completely normal. So the question is what is it that causes the body to go out of normal? And that is symptoms, but symptoms are caused by stress, right? So here's a bunch of symptoms, and maybe you've had some of these, or maybe you have all of these. Headaches, congestion, and I'm going to read them because you may not be able to see them real easy. Headaches, congestion, fatigue, irritable bowel syndrome, aches and pains, constipation, and diarrhea, and one or the other, or both, bloating, skin rashes, thyroid disorders, foggy thinking, immune diseases. You just might get sick a lot. You may have trouble losing weight. You may have trouble gaining weight. You could get infections often. That's a big symptom. Irritability and anxiety. This is not a conclusive list. You may have symptoms that are not on this list, but that's all that would fit on my board here. So what happens when you have these symptoms and you go to your doctor? You get drugs, and hopefully not a surgery, but a lot of people do. So you're getting drugs and surgery and lifestyle medicines, because when the drugs stop working, it's very common for people to have to take another drug. Well, that one didn't work. Now I recommend you get, that's the doctor talking, I recommend you get on this new drug because it just came out, or the pharmaceutical rep told me that it helps this condition. So it becomes an endless loop of lifestyle medications and possibly surgery, right? Nothing's been fixed. None of these symptoms have really gone away, have they? Because the root causes haven't been dealt with. So that's what the difference between, let's talk about the difference between the traditional medical model and functional medicine, right? So functional medicine, is it more of an integrative kind of a thing? Basically, it's considered 21st century medicine. More and more doctors are realizing that symptoms are not the real problem. The real problem is hidden beneath the surface. It's like the iceberg. When you look at an iceberg, you just see the tip of the iceberg. But what's underneath that iceberg is really a ton. I mean, it's like 90% of that whole block of ice is hidden beneath the surface and you can't see it. So the training of a functional medicine physician, like I am, is that not only do we both take a history and we both look at lab tests that are from the past and may look at past treatments, but the real difference is here. It's in the lifestyle, it's in the diet, what you're eating, it's in your exercise habits, and it's all about the weakened systems of your body. The weakened systems of your body is what we should be looking at, because that's where the root problems are. The systems of your body are the gastrointestinal, the immune, detoxification, endocrine, neurotransmitters. We're going to definitely talk more about these systems of your body in the next video. But when we can identify which of these systems crashed first and address it, these symptoms generally will go away. And that's the reason why functional medicine practitioners like myself get such good results, amazing results. So in the next video, what we're going to talk about is we're going to dive deeper into the systems of the body in general. We're also going to dive deep into the 4 most common sources of stress, which are physical, emotional, chemical, and would you have ever thought hidden gut infections could exist in your body? Well, that is a huge source of stress. And that's the one that most physicians miss. So I want to thank you for taking the time to watch this video demonstration of the brain-body diagram. Please feel free to share this with your family and loved ones. Wouldn't it have been nice if your doctor would have talked to you about this kind of stuff instead of just dishing out another medicine? My name is Dr. Alan Nathans, and I look forward to helping you and talking to you more about this kind of valuable information about your health to help you restore your health.